After your initial episode of pancreatitis, did you completely go back to your baseline where you were symptom-free when you left the hospital? Were you still having pain?
No, actually, I wasn't symptom-free. I was having a lot of pain. I couldn't eat without feeling sick, and it was very confusing to me, very confusing. I didn't have enough information, and I was scared, and the whole situation was new to me.
For me, I was symptom-free when after I was released from the hospital. I didn't have any more symptoms other than an occasional heartburn here and there, which I've never had heartburn before. So they did put me on medication to help with the heartburn, and I was on that for a long time. But then I had symptoms again maybe about a year or so later, and it landed me back in the hospital and did more tests, and you know, still no reason as to what was causing it. And I just lived with it for many years until recently in 2010 when I had surgery. But yeah, it was very difficult, not being able to understand why it was happening and why it was continuing to happen. So.
With me, I had pain when I still left the hospital, and not knowing what was wrong, they're telling me to take all this meds, you know, but I didn't know why, and I had to see my doctor immediately when I got back, and then he saw me and he put me back in the hospital. And then when I got out of there, they had an appointment to meet with Dr. Gardner, and when I met with him, he put me in the hospital and did a scope the same day that day, because you know, so it was the whole summer I was in the hospital and just, you know, NPO and just taking medicine. It's the only way, you know, they said that would cure it, so. But very painful, heartburn. You know, a lot of it was like, I wanted that lidocaine that they can give you, you know, it was bad. So I had constant pain all the time.
So it was pain in the form of heartburn, or were you having also belly pain that was severe?
The belly too, but then like the heartburn, it just felt like I could blow out fire. Mm-hmm. You know, that's how bad that the heartburn was. And I don't know if you've ever had, you know, heartburn, but it was just awful. Awful feeling. So, you know, and they kept me medicated, and so I really didn't even know what was going on pretty much, you know, the whole summer. And then until I met Dr. Gardner, really, and, you know, he's explained what a lot of it was, you know, so then I learned more about it. But I don't think I had ever had where the pain was gone.